Welcome to checkpoint number 3. In the following module, you will learn about medications. There will be a small quiz at the end to test your knowledge. Enjoy! In this module, you will learn a little bit more about medications and their effect on exercise. The highlight of the section is learning and understanding the general precautions that you will need to know when prescribing exercise for individuals who are on medication. It is important to understand the effect that each medication has on the individual and how it relates to exercise. It is important to understand the general precautions that you as a personal trainer need to take when working with an individual who is on medication. This will ensure the safety of the participant and help instill confidence in you as a personal trainer. If the individual is feeling unwell, they should stay home. When an individual is on medication, it is also important that their pulse is monitored constantly throughout the exercise session. This is also for the safety of the participant. We want to make sure that their heart rate is not abnormally low and is not abnormally high. If any abnormalities are seen, the exercise session should stop and the individual should be advised to see their doctor. It is also important to understand and have a list of the client's medications on hand. This will help you to understand the specific exercise considerations and will help to ensure the participant's safety throughout the session. If in doubt, HWEP covers a 30-minute consultation on medications if the individual is on 2 or more medications. You can also consult the information in this presentation as well as in the medication chart to help identify special considerations to exercise. Antiplatelet medication prevents blood clotting. They do this by preventing the platelets in the blood from combining together and forming the blood clot. Aspirin is a medication that everyone is already familiar with, and it is actually an antiplatelet medication. It serves as the first-line measure against heart attacks. In this case, the aspirin should be chewed to allow it to reach the bloodstream more quickly. Other names for antiplatelet medication are Plavix and Ticlid. What is important to understand is the effect that antiplatelet medications will have on the individual and thus on exercise. Although these medications have no direct effect on exercise, they do affect the way that the individual feels. Individuals may have nausea, feel itchy, an upset stomach, have rashes, or diarrhea. This in turn affects their mood and ability to exercise. You may not want to push an individual to perform certain exercises if they are having stomach pain, especially if the exercise is going to worsen the issue. Thus, it is important to ask the client how they are feeling and if they are experiencing any side effects from their medications before the exercise. Anticoagulant medications are also known as blood thinners. They essentially thin the blood to prevent blood clot formation and growth. Common names for anticoagulant medications are Coumadin and warfarin. What is important to understand is the effect that these medications will have on the individual and thus on exercise. These medications have no direct effect on exercise. They do, however, cause internal and external bleeding, excessive nose and gum bleeding, and having brown or red urine, which would be an indicative sign of internal bleeding. In these cases, the individual should be advised to go and see their doctor. It is also important to ensure that we are extra careful with clients on anticoagulant medications and that we do not injure them in any way that could cause any type of bleeding. If by chance an individual does get injured and it manifests into bleeding, you want to immediately treat with first aid and apply direct pressure to the wound to promote blood clotting. If you notice that an individual on these medications develops a bruise and the bruise does not seem to be healing correctly, advise them to go and see their doctor, as it may be a sign of internal bleeding. When prescribing exercise for these individuals, simply make sure that they are safe and that they do not cause any injuries. Why is it important to make sure that your client has taken their blood pressure medication? If an individual does not take their blood pressure medication, exercising will put an excess amount of strain on the individual's cardiovascular system and will cause their blood pressure to skyrocket. This is dangerous. It can lead to serious injuries and even death. Make sure that your client has taken their blood pressure medication before working out. Beta blockers work to decrease blood pressure by decreasing the individual's heart rate. Beta blockers can be identified by medications that end in OLOL. Action of the beta blockers is to decrease heart rate, decrease force of contraction, and decrease the rate of AV conduction. It is highly important to understand that beta blockers decrease the heart rate response to exercise. This needs to be taken into consideration when monitoring individuals who are working out. You can no longer rely on heart rate to tell if your client is working hard. You must rely on their personal rate of perceived exertion, RPE scale, which will be covered in detail in exercise prescription. Other side effects that beta blockers have are as follows: general fatigue, lightheadedness or dizziness, cold hands and feet, decreased libido, and masking signs of lower blood sugar. Angiotensin-converting enzyme inhibitors, or also known as ACE inhibitors, work to decrease blood pressure by relaxing blood vessels. These medications also serve as a protective factor for the heart and for the kidneys. ACE inhibitors can be identified by medications that end in pril. For example, ramipril and enalapril. A side effect of ACE inhibitors is a dry cough. Individuals who experience this side effect are put on angiotensin receptor blockers. These medications function just like the ACE inhibitors, but do not have the cough side effect. They can be identified by medications that end in tan. Neither of these medications have any direct effect on exercise. Again, it is still important to ask your client if he or she is experiencing any other side effects from the medication. For example, dizziness or fatigue or feeling lightheaded. You want to take these side effects into consideration when designing your client's workout plan. Diuretics are used to decrease blood pressure and to treat heart failure. They accomplish this by increasing the amount that the individual urinates. This in turn helps to flush out salts from the body and leads to a lower blood pressure. Individuals that are on diuretics can easily become dehydrated, and this can lead to decreased potassium. This will manifest itself through the individual feeling lightheaded and dizzy. Thus, you want to make sure that your client is consistently replenishing any fluids that they are losing. It is extra important to make sure that these individuals are taking water breaks and are trying to stay well hydrated. Overall, diuretics have no direct effect on exercise. Again, you want to make sure that your client maintains their hydration level. Other signs and symptoms to watch for are dry mouth, muscle cramps, weakness, fever, sore throat, or a skin rash. If you see any of these signs and symptoms, you want to discontinue your exercise session and advise your client to consult with their doctor or pharmacist. Calcium channel blockers are a class of drugs designed to decrease blood pressure. The commonly used name for these class of drugs generally ends in the suffix "-pine". This decrease in blood pressure is caused by widening of the blood vessels to increase blood flow to the heart, preventing chest pain during exercise. Calcium channel blockers have no direct effect on exercise capacity, but they do prevent chest pain and can help slow irregular and fast heart rhythms. However, calcium channel blockers do come with some side effects. The effect they have on heart rate is dependent on each individual and how they react to the medication. Common side effects include dizziness or lightheadedness, fatigue, peripheral swelling in the lower limbs, flushed skin, and headaches. Individuals on calcium channel blockers should be cautioned not to consume grapefruit while on the medication. Grapefruit and calcium channel blockers compete for the same pathway in the liver, which severely inhibits the drug's effectiveness.